recording.
All right. Well, good morning. I am Chantel Leatherwood. I am the Chief Executive Officer of Christ Community Health Services, and it is my pleasure to share with you this morning that Christ Community has received an award from the Bureau of Primary Health Care to expand services to Jackson, Tennessee. And the grant award will provide us with $650,000 annually to serve the medically underserved population in East Jackson, Tennessee. And this actually came about because of a couple of people. Dr. Lisa Piercy is one. She is the Tennessee Commissioner of Health, and she was one of the executives working at West Tennessee Healthcare about a year ago. And she introduced us to a family, one of which is Dr. David Larson, who is a family medicine physician in Jackson, Tennessee. And he had a desire to develop a faith-based health center to serve the needs of the East Jackson population. And they reached out to us and said, would you be a partner with us? They were in need financially, and they asked us if we could come alongside them and acquire them. And at that time we thought, oh wow, we have not thought about expanding beyond Shelby County, but we're willing to speak with you. And fast forwarding, we applied for new access point funding. We met with the leaders of West Tennessee Healthcare, and they were excited about us coming there. And so today we are very excited to share that we will be expanding. We will be opening another Christ Community location at the end of this year, and we will do that in partnership with West Tennessee Healthcare as well as the Bureau of Primary Health Care. So thank you very much. Are there questions?
For those people who don't know about Christ Community, introduce them a little bit to Christ Community and tell them about Christ Community and your work and your service.
Well, certainly. Christ Community was founded in September of 1995 by 4 young physicians who developed a blood pack in medical school to start a health center because of their faith in the most medically underserved area in the nation. And they found that Memphis, Tennessee had one of the most medically underserved areas here in Shelby County. They began operations in September of '95, and we have been providing services since then. We're now almost 25 years old. We'll be 25 years old next year. And currently, we serve over 57,000 residents here in Shelby County through 8 health center locations, health and dental center locations. We also provide homeless services through a mobile van in partnership with Baptist Operation Outreach and Baptist Memorial Health Services. Today, we have about 390 employees.
What can the people of Jackson and the surrounding communities expect in terms of health care from Christ Community?
Sure. So for the residents in Jackson, Tennessee, they can expect for a Christ Community to deliver the same level of services that we deliver here in Shelby County. Our goal is to provide primary health care services coupled with behavioral health services. Our goal is to expand and start dental services in a year or so. We're also working to develop partnerships there in the area, one of which would be with Union University to recruit staff members to the Jackson Health Center. And we're also working to partner with West Tennessee Healthcare to help them offload their ED and actually connect uninsured individuals to primary care services.
Any projection on how many patients
to
you
be
might look
served?
forward to serving?
So in the
over
first
course of the
2
first year?
years, our goal is to serve about 3,100 patients. We're told by West Tennessee Healthcare that there is a great demand for the services and that we might find ourselves really busy fairly quickly. But our hope is to ramp up quickly. Our hope is to recruit a number of clinicians to the operation so that we can actually serve the holistic needs of those in East Jackson, which currently has about 31,000 residents.
There's a lot of talk nationally, obviously, about the uninsured and coverage and all of that. Will that be a factor that you see for the residents of the Jackson area?
So that would be a factor. That's really one of the reasons why we exist, and it's to serve those who lack healthcare services. And so we will be providing discounted services to those who are in need. Our goal is to provide services to anyone, regardless of their ability to pay. Our goal is to provide wraparound services for uninsured individuals through partnerships. We've already worked on partnerships. We have a number of referral arrangements and MOUs in place. Some of the team members have already traveled to Jackson to develop some of those partnerships. So our hope really is to become the healthcare safety net provider in East Jackson, Tennessee, as well as to help them overcome some of their barriers and possibly help them pursue healthcare coverage.
My last question is, what about the staff at the Jackson Center? How many positions will there be?
Oh, that's a very good question. So in the first year, we actually plan to have 2 primary care physicians. I'm looking in the audience to make sure I'm correct. So 2 primary care providers within the first year. Our hope is to recruit a licensed clinical social worker to the health center. And our goal is to start dental services by July of next year. That's correct. One of the other plans that we have is to provide behavioral health services via telehealth prior to recruiting that licensed clinical social worker. And then I believe our plan is to actually also hire about 15 support staff members, which would include some of the existing staff from the Faith Health Center. Any other questions from the audience? Well, thank you so much for joining us today as we celebrate this expansion to Madison County or Jackson, Tennessee.